the support that you have after you deliver is important as well, because as you know that it's not just hormonal changes that you may face also psychological changes or emotional changes as well, and this depends to a lot of reasons as well. So breastfeeding is encouraged, but as you know, it can be really quite challenging as well, and if you don't have the right support, and then you know that can cause a lot of emotional distress to the mother as well.
Absolutely. So actually in my work, I do support women who have difficulties with breastfeeding.
Yeah,
and then sometimes
that's true.
there's a lot of pressure coming from either family or sometimes the confinement lady to breastfeed. And there's a lot of pain and there's a lot of anxiety. And when they feel stressed and they feel anxious, the harder it is for the milk to come.
Yes, that's
And then
true.
they feel really guilty that they cannot provide.
They think they're a failed mother if they can't breastfeed.
Yes.
And
So
then, you know, and that's not true.
that's not true. Finally, like my second baby came, and you know how in the beginning stages when you're waiting for the milk to kick in, even that anxiety, the heightened anxiety that, oh my gosh, like what if I cannot provide milk for my child? That actually impacted my ability for the milk to come. And then my doctor said, you know, you have to actually relax.
Exactly, because a lot of women don't realize that when you deliver and you want to breastfeed, the milk doesn't really come immediately sometimes. You don't just straight away get the milk. Sometimes it takes a day or 2 days for the milk to come, and this creates anxiety for a lot of women. And I think what you're doing is also, you know, it's amazing because you provide also support for these women, because these are real anxieties that women actually don't talk about but should talk about.
Yeah, and sometimes the inability to breastfeed and provide naturally causes depression.
Exactly,
They can be pretty depressed about it, particularly if family is not understanding, or particularly if they have the idea themselves that they want to breastfeed but they cannot provide, so they cannot meet their own expectations. There's often times where they start to feel a lot of guilt, a lot of shame, and they can get pretty depressed.
Yeah.